Hi everyone, I'm here. Have you ever experienced heartburn? Heartburn, also known as acid reflux, is a burning sensation in your chest that occurs when stomach acid flows back up into your esophagus. It can feel uncomfortable and even painful at times. But what causes this to happen? In this video, we will explore 8 common causes of heartburn. The first cause of heartburn is a weakened lower esophageal sphincter. The lower esophageal sphincter, also known as the LES, is a muscle that helps keep stomach acid from flowing back up into the esophagus. When the LES weakens, it can allow acid to flow back up, causing heartburn. Several factors can weaken the LES, including obesity, pregnancy, and certain medications. These factors will be discussed further in this video. The second cause of heartburn is overeating. When you eat a large meal, it can put pressure on the stomach, forcing the LES to relax. This allows acid to flow back up into the esophagus and can trigger heartburn. To help prevent heartburn, it's important to eat smaller meals throughout the day rather than 3 large ones. This can help keep pressure on the stomach to a minimum and reduce the risk of heartburn. Additionally, you should wait at least 2 hours after eating before lying down. This can help prevent acid reflux during sleep. The third cause of heartburn is certain foods. Certain foods can trigger heartburn by relaxing the LES or by irritating the esophagus. Fatty, spicy, citrus, or acidic foods are most likely to cause heartburn. Common trigger foods include chocolate, coffee, onions, garlic, tomatoes, and citrus fruits. If you think certain foods are triggering your heartburn, keeping a food diary may help identify which foods are most likely to blame. By keeping track of the foods you eat and any symptoms you experience, you can begin to see a pattern emerge and make more informed dietary choices. It's important to note that while these foods may trigger heartburn in some people, they may not affect others in the same way. Everyone's triggers are different, and it's important to pay attention to your body's response to certain foods. Once you've identified your trigger foods, you can take steps to avoid them or limit the amount of heartburn they trigger. For example, you may choose to avoid eating citrus fruits if they trigger your heartburn, or you may choose to eat fatty foods in moderation. By making these adjustments, you may be able to reduce the frequency and severity of your heartburn symptoms. Fourth, beverages. Certain beverages, such as caffeine, alcohol, and carbonated drinks, can contribute to heartburn. Caffeine and alcohol can relax the LES, allowing acid to flow back into the esophagus. Carbonated drinks can also relax the esophagus muscles, making it easier for acid to flow back up. In addition, drinking through a straw may help reduce the amount of carbonation in your drink and reduce the risk of heartburn. Quitting smoking may also help reduce heartburn symptoms as smoking weakens the LES and reduces saliva production, which can exacerbate heartburn. The fifth cause of heartburn is obesity. People who are overweight or obese are more likely to experience heartburn due to the excess fat putting pressure on the stomach. This can weaken the LES and make it more likely for acid to flow back up into the esophagus. Losing weight can help reduce the frequency and severity of heartburn symptoms. A healthy diet and regular exercise are important to achieve and maintain a healthy weight. The sixth cause of heartburn is pregnancy. During pregnancy, hormonal changes can cause the LES to relax more often, making it easier for acid to flow back up into the esophagus. In addition, the growing baby can put pressure on the stomach, exacerbating heartburn symptoms. These symptoms are usually mild and can be relieved with lifestyle changes, such as eating smaller meals and avoiding trigger foods. However, if heartburn becomes severe or persists after delivery, it's important to seek medical attention. The seventh cause of heartburn is smoking. Smoking has been shown to weaken the LES, making it more difficult for it to keep stomach acid from flowing back up into the esophagus. In addition, smoking can reduce saliva production, which can exacerbate heartburn symptoms. Nicotine, the main active ingredient in tobacco products, can stimulate acid production in the stomach, leading to more frequent and severe heartburn episodes. Quitting smoking is an effective way to reduce the risk of heartburn and improve overall health. Fortunately, there are resources available to help people quit smoking, such as nicotine replacement therapy and medications that can reduce cravings and withdrawal symptoms. By quitting smoking, individuals can not only reduce their risk of heartburn, but also lower their risk of developing other chronic diseases such as heart disease, stroke, and lung cancer. The eighth cause of heartburn is certain medications. Certain medications can contribute to heartburn by relaxing the less or slowing digestion. Some of these medications include antihistamines, antidepressants, sedatives, and narcotic pain relievers. In addition, some medications such as aspirin and ibuprofen can irritate the esophagus and trigger heartburn. Taking medication as directed and talking to a healthcare provider about potential side effects can help minimize the risk of medication-induced heartburn. It's making simple lifestyle changes such as eating smaller meals and avoiding trigger foods can also be helpful in managing heartburn caused by medications. In conclusion, heartburn is a common problem that can be caused by various factors, including a weakened less, overeating, certain foods and beverages, obesity, pregnancy, smoking, and certain medications. While occasional heartburn may not be cause for concern, persistent or severe heartburn should be evaluated by a healthcare professional. By understanding the causes of heartburn, making lifestyle changes, and avoiding trigger foods and beverages, you can help prevent and alleviate this uncomfortable condition. Thank you for watching our video on 8 common causes of heartburn. We hope you found this video informative and helpful. If you have any questions or comments, please leave them below. I'd love to hear from you. And don't forget to like and subscribe for more health and wellness videos. Stay healthy, stay informed, and take care.